So friends, we are discussing right now the heat related illness. So we will discuss what are the diseases that are caused by exposure to heat, and it is important because in 2026 we are will experience a lot of heat this summer. So this is important to know what are the diseases which are caused by the heat. So let's first understand what are the sites where we can measure the body temperatures. So for core body temperature, we can measure the temperature in the pulmonary artery, in the lower end of the esophagus, and in the rectum. So these are the central or the core temperature is being told by the pulmonary artery, that is the lower end of the the pulmonary artery, by catheterizing the pulmonary artery, or at the lower end of the esophagus, or at the rectum. With the digital thermometer, we can assess the rectum very easily. We will place the thermometer inside the rectum and we can measure the temperature. For surface temperature, we can record it from the axilla, or from the oral mucosa, or from the skin. So they record the surface temperature, and the center temperature is important to know. It is also called the core temperature, and it has to be kept constant. It remains constant because it favors or it supports the temperature and supports the vital organs like our heart, like our lungs, brain. It maintains the temperature very much constant by this central temperature or the core temperature, while the surface temperature fluctuate with the outside heat. So later on we will discuss what is the importance of the core temperature. It is constant for the timing. You remember, it remains constant, the core temperature. Now, as we measure the body temperature, the rectum temperature is always higher than the oral temperature, and oral temperature is always higher than the axillary temperature. Rectum temperature followed by oral temperature and then axillary temperature. So these are the various temperatures we can measure. For rectum, the temperature varies from 36.2 degree to 37.7 degrees Celsius. Then for oral temperature, it varies from 35.7 to 37.3 degrees centigrade. And axillary temperature varies from 35.2 to 36.8 degrees Celsius. So the rectal temperature is higher than the oral, and oral is higher than the axillary. So these are the various parameters of the fever. The normal fever varies from 36.1 to 37.2 degree Celsius, and as we move from 37 to 38 degree Celsius, it is called low grade fever, and from 38 to 41 degree Celsius, the temperature is called the pyrexia, and between 41 to 43 degree, it is called the hyperpyrexia. So low grade fever followed by pyrexia followed by hyperpyrexia, and after 43 degrees centigrade, the condition of the patient is usually very fatal. And below 36.1 degrees centigrade, the patient suffers from hypothermia. Hypothermia varies from 36.1 degrees Celsius to 34 degrees Celsius. And below 34 degrees Celsius, the condition is fatal hypothermia, and it is more dangerous. Now let us understand the thermoregulation of the body. So here is the anterior hypothalamus located, and here is the posterior hypothalamus located. So this is the set point of the body, 37 degrees centigrade set point. This is the set point. So as the temperature goes below the set point, the hypothalamus starts warming up. It initiates certain mechanism, and the hypothalamus start warming up by various mechanism. And in this condition, our posterior hypothalamus works to increase the body temperature. As the body temperature falls, the posterior hypothalamus work to increase the body temperature and brought it back to our set point, that is the 37 degrees centigrade. And also, as the body temperature rises, our anterior hypothalamus works to lower the body temperature. It initiates certain mechanisms that will try to reduce the body temperature, and as the body temperature goes above the 37 degrees Celsius, as the mechanism is initiated by the anterior hypothalamus, and it will brought back to 37 degrees centigrade. So this is the thermoregulation which is going on in the body. How these hypothalamus works to cause these heat changes, I will discuss it now. So as we are gaining heat in the summer seasons, our anterior hypothalamus will work to reduce the heat. What it will do, it will send the signal. The anterior hypothalamus will activate the sympathetic nervous system, and when the sympathetic nervous system get activated, it will act on our sweat glands, and we start sweating. And as we sweat, we will lose the heat by sweat. By evaporation, the heat is lost from the body. And also it will cause our hair follicles to relax, and as the hair follicles relax, they no more catch the heat from outside, as they will relax. And also our blood vessels dilated in response to the sympathetic stimulation. As the body temperature rises, the vasodilation causes the more blood flow from the center to the periphery, and as the blood flows to the periphery, the heat is lost from the skin. So as we exposed to heat, our anterior hypothalamus will work to stimulate the sweat gland for causing the evaporation, or for causing the sweating from the skin, and we lose the heat. And hair follicles will relax, and we no more gain the heat. And the blood vessel will dilate, and the blood reaches from center to periphery to cause the heat loss. Opposite to that, as we exposed to cold, our posterior hypothalamus will work, and it will send signal to the skeletal muscle to cause the contraction of the skeletal muscle, and it will produce more heat. Also, the sympathetic system causes the piloerection, that is, our hair follicles become erect, and they will gather more heat from the outside with the help of sympathetic nervous system activation, and we will gain more heat. And also the blood vessels will constrict in response to the stimulation, and we will conserve heat. So as we expose to cold, posterior hypothalamus will work. It will cause the skeletal muscle contraction to conserve the heat. It will cause piloerection to gain the heat, and it will cause the blood vessels to constrict to gain the heat. Now, this is the normal blood flow. Normally 4% of the blood flows to the skin for heat loss. But when we are under heat stress, about 48% of the blood flows to the skin. As we can see here, 48% flows to the skin for heat loss. Now, what is hyperthermia? So hyperthermia occurs because of the failed thermoregulation. Though elevated body temperature which occurs in hyperthermia, it is because of the failed thermoregulation, and the body produces or absorbs more heat than it loses. So body produces and absorbs more heat, rather it is unable to lose heat. So hyperthermia occurs because of the failed thermoregulation. It is defined as a temperature more than 37.5 to 38.3 degrees centigrade, and it occurs without a change in the body's temperature set point. So there is nothing a change occur in the set point. Set point remains constant in hyperthermia. Rather, the body will gain more heat. It produces more heat. It absorbs more heat, but unable to lose the heat in hyperthermia. So the set point does not change in hyperthermia. This is very important line, because in fever the temperature set point changes, while in hyperthermia the set point never changes. Very, very important. So these are the differences between fever and hyperthermia. We need to know this because we can be confused between fever and hyperthermia. So fever is also called the hyperpyrexia, and hyperthermia, the extreme form of hyperthermia, is called the heat stroke. So what happens in fever? The hypothalamic set point is raised. The hypothalamic set point is raised like resetting a thermostat. It is reset at 37 to 39 degrees centigrade. The patient becomes febrile and the set point is raised in fever. While the set point remains at 37 degrees centigrade, that is normothermic, the hypothalamic set point never changes in hyperthermia. Heat regulation fails or overwhelmed in hyperthermia. Fever occurs because the bacteria viruses enter the body. That's why the fever occurs, and their heat production occurs by shivering and non-shivering thermogenesis. While in hyperthermia, either exogenous heat production or endogenous heat production occurs. Heat gain is more than the heat loss in hyperthermia. Now in fever, there occurs the vasoconstriction, which will try to conserve heat, and the patient will feel cold. Because of the vasoconstriction, the heat is conserved. While in hyperthermia, the skin is very much hot, often dry. Sweating is usually blocked in hyperthermia, so the skin becomes hot and dry in hyperthermia. Also, the antipyretics, like we give aspirin and acetaminophen, it usually responds to antipyretics. The fever responds to antipyretics, while hyperthermia does not respond to antipyretics. Very important, it does not respond to antipyretics because the set point is not changed in hyperthermia. So one more term is, what is hyperpyrexia? Hyperpyrexia is increase in body temperature above 106.7 degree Fahrenheit or 41.5 degree centigrade. The increase in body temperature which is more than 106.7 degree centigrade Fahrenheit, it is hyperpyrexia. And there are few causes of hyperpyrexia we should know. These include your severe bacterial or viral infection, a brain hemorrhage, a tumor in the brain, or an overactive thyroid, or a reaction or a negative reaction to anesthetic medications, or sometimes the recreational drug abuse like cocaine. So these are the causes of hyperpyrexia. So why these hyperthermia precipitate? There are certain causes. If you are working in a strenuous exercise activities outside on a hot day, if you are doing strenuous activity, the hyperthermia can precipitate. Or sometimes you are working in a hot room with no air circulation, or you are not taking enough fluid while working, or you are working in a building where cooling system is not working, or sometimes when the humid conditions combined with hot temperatures, all these conditions increases the risk of hyperthermia. Very important, hyperthermia. Now the spectrum of heat illness. We should know what is the spectrum of heat illness. So initially, on exposure to heat, the patient can have heat edema or heat rash, or then it progresses to heat cramps. From heat cramps to it goes to heat syncope, and from heat syncope to heat exhaustion, and from heat exhaustion to heat stroke. So the extreme form of heat illness is called the heat stroke, and the milder forms are called heat edema, heat cramps. These are the minor forms, and these are the moderate, and it is the severe form of heat illness. So as we move towards the right hand side, our thermoregulation fails as we move from left side to right side. So initially there is heat edema, followed by heat cramps, then heat syncope, then heat exhaustion, and finally heat stroke, which is an emergency situation. Here the thermoregulation does not work at all. This is heat stroke. Now, what is heat edema? Heat edema or heat rash is the pitting type of edema which is commonly found in the hand and feet. As we can see on the feet, you are finding a pitting type of edema on the ankles or hand and feet. So this is pitting edema on exposure to heat. It lasts from days to weeks and it occurs in bedridden elderly more often, and it occurs because the high temperature causes the vasodilation and there occurs the fluid accumulation in the hands and feet. It leads to pitting edema, and here the pitting edema you are not going to use diuretic. Remember this line, diuretic should not be used in this condition because it is not due to any heart failure. It is occurring because of exposure to heat. So the treatment will be self-limited. Reassure the patient, ask him to limb elevate and do bandages, avoid high temperature and ensure adequate rehydration. So this is the heat edema which occurs because of exposure to. So what are heat cramps? Heat cramps these are the localized painful involuntary spasms of the skeletal muscles. As you can see, there is involuntary spasms of the skeletal muscle. These are very painful. These are heat cramps, and the common causes of heat cramps are sodium and chloride depletion from the body. Sodium and chloride depletion, and also due to dehydration, or sometimes because of the impaired circulation in the working muscle. There is impaired circulation in the working muscle that can lead to the heat cramps. And also there is alteration in the spinal neural reflex activity which is increased by the fatigue. So alteration in the spinal neural reflex activity which is increased by fatigue. And most commonly affected muscles in heat cramps include your calf muscles, your quadriceps, your hamstring, and your abdominal muscles. So these are heat cramps. So what are the signs and symptoms for heat cramps? These include your possibly nausea can sometimes be seen in some patients. Some patients, they feel the broad like stiff abdominal muscles, broad like cramped abdominal muscles. They can have nausea, they can have sweaty skin, weakness or fatigue. However, the body temperature remains normal, blood pressure remains normal, mentation status remains normal, and there is a normal to slightly elevated heartbeat can be seen. So these are heat cramps. For the treatment of heat cramps, you can do the slow passive stretching of the involved muscles. You can do the passive stretching of the involved muscles. You can massage. Here you can see you can apply the ice or you can do the massage, and you have to replace the fluids for heat cramps. Many returns to the activity when the symptoms subside. Many people return to their normal activity. So these are heat cramps. So what is heat syncope? Heat syncope occurs as a result of insufficient blood supply to the brain, which occurs because of the vasodilation of the skin vessels, thereby leading to decreased venous return and less cardiac output, and this is less cardiac output, and this will lead to the low perfusion to the brain, and patient will have fainting. So vasodilation causing reduced venous return, which leads to the reduced perfusion to the brain, and there you can see that this patient has heat syncope because of vasodilation and reduced cardiac output to the and reduced blood supply to his brain, that leads to the loss of function, and this is heat syncope. And there occurs the drop in blood pressure as a result of vasodilation. So the symptoms of heat syncope include lightheadedness, dizziness, and fainting. And the treatment, you have to put the patient in a cool place and elevate the legs. As you can see, the legs are elevated. If the patient regains consciousness, you will ask him to rest and ensure adequate rehydration. If the patient remains unconscious, treat it as a shock. Now, what is heat exhaustion? It is the most common form of heat illness. It is caused by the heat exposure and increased activity plus decreased intake of fluids. The symptoms of heat exhaustion include headache, weakness, fatigue. Skin is usually moist and there occurs the heavy sweating. You can see heavy sweating in heat exhaustion. The patient is cold and pale. And there may be hyperventilation, low blood pressure, and fast, weak pulse can be seen in heat exhaustion. There may be anxiety and confusion also. For the management of heat exhaustion, you will move the patient to a colder location, make him lie down and loosen the clothes, apply wet towels or ice, use fans, ensure adequate oral and IV fluid replacement for heat exhaustion. Here you can see you can apply the wet cold towel or you can use the ice, you can use the fans and fluids.